Well, it's possible for some organs, not for all of them, of course. But for the dual organs, like the kidneys, it's possible to do living donor kidneys. And every year, about 6,000 Americans have a kidney transplant with a living donor. And it's possible to do it with liver, which is not a double organ, it's a single organ, but can be divided. And so it can be divided also in different areas, so that in a certain way offers the opportunity of transplanting people according to their size. So if you need to transplant a baby, you give only a little portion of the liver. If you have transplant a mid-size person, you give the left side of the liver. If you need to transplant somebody like our friend, then you give the right side, which is the bigger portion of the liver. Yeah, and usually that's what we look, although there can be some discrepancy in size between the donor and the recipient. And there are other factors that have to do with age and anatomy, so the way the liver is shaped. But in general, there's supposed to be a certain equality between height and weight between the donor and the recipient. That's what we do. We usually match them by blood type, so there is no process that is different than we usually do for the so-called disease or brain dead donor. They are allocated, as we say, based on blood type. It's a fairly, straightforward and simple, yes. But part of it has to do with the particular shape and what we call in our terms anatomy of the liver. The liver is very prone to be divided. It can be divided in different segments. And this is helpful because, of course, every single segment at the end of the day can work as a single unit. And then the other factor is that the single unit, which is small in the beginning, can grow. And so not only the liver in the donor who donated it grows back to normal size, but also it will grow back in the recipient. So this is one of the things that are very fascinating about this kind of surgery, is that if you go over the idea of putting somebody at risk, because every single surgery has some risks attached to it, once you're over the risks of the surgery, the function of the liver returns to be exactly the same it was before the surgery started. So if you started off 100% of function prior to the surgery, you donate even 60-65% of your liver, in a few months you will be having again 100% of your function. So you're back to normal. Well, I think the word of them, because it's been something I've been doing and I've been fascinated about for the past 20 years of my life. And it started off with the little children. So you had the children that had disease in their liver, and we had a shortage of organs because most of the donors are big size. So we had the parents or the relatives of these children donating a little portion of the liver to them. But it was fascinating because at that point, the recipient of that liver didn't have any say. He's a small child and he's just doing, what the parents want him to do. And then we expanded that into the adult population. And that's where we started really to see different personalities come about. Because most of the donors I interact with before the adult living donor was brought to reality were parents, so had already a very invested interest in the life of the child. When you do into the adult population, then you have the friends, you have the distant relatives, and you have the altruistic donors who just feel like it's a very, for them, important and right thing to do to donate part of their liver. And every donor has a different personality, every donor has a different story. Some stories may be more captivating than others, but in reality, every donor is a fantastic person. I think most of the donors are special persons to start with. We gave for granted the idea that if somebody is in need, we're going to come to the rescue. But then when really something needs to be done, not everybody wants to come to the rescue. So the donors who, I always tell them, just the simple fact that you had the courage to come to this clinic and talk to me about living donation shows that you are a person who's really willing to do something. And then in an entire journey, starting from the first conversation I had with them to the point of doing the surgery, you really come to surface like a very special person. It takes, I don't think it's only courage. It takes really a certain kind of personality, dedication, respect for life, love for people. There are so many sentiments and reality that come to play a role in donation that it's very difficult to summarize that with just the idea that somebody is a hero. I think most of the donors are not heroes. Most of the donors are very good people. My experience, and this is also I have to say, my personal experience so many years, I really rarely met somebody who wants the spotlight and wants to be considered a hero. Most of the donors I met and I have a good relationship with, I still have interaction with the donors that I operated 15 years ago. They are excellent, beautiful human beings, and they go about in their life, and when things go well, they have the inner calm and the inner satisfaction having done something very, very important for somebody else. Well, but that's one of the beautiful thing about this kind of job in a certain way. The satisfaction you get by knowing that there is almost a downfall effect, right? You think you are taking care only of one person, but then everybody else benefits. And I think this is also the drive for many family members or for many friends that are willing to step up to the plate and decide to be donors, is the idea that they're going to enhance everybody else's life, not only, of course, the principal subject is the recipient, but everybody benefits. And the simple fact that you eliminate the waiting time is pivotal, because of all the stories that you hear about people on the waiting list. I think the most dramatic one, and is a recurrent theme, is the one of having to wait and not knowing when the transplant will occur.
Right.
And the transplant is really a turning point, is the tipping point. And the idea of the living donation and the magnitude of the benefit that the donor delivers to the recipient is given probably by taking away the big question mark: when am I going to be transplanted? When this moment will come? Don't get me wrong, there is a lot to be done also on the side of the cadaveric or disease donation, because we can still improve some. But all the data we have show that the gap, which is the difference in number between the patients on the waiting list and the organs available out there, is increasing. The number of the diseased donor is steady, at least in the past 11 to 12 years. And so at the end of the day, even if we were going to maximize our efforts to get every single person that dies or their family to allow us to take the organs and do transplant, we'll still be short in terms of being able to fill the gap between the people who wait and the organs needed. So living donation becomes really at the present time, until we will invent something new. And maybe something is in the pipeline, but not now. So today, the best thing that we want to do is tell people, believe in living donation, have faith in the doctors that are doing it. We have a lot of stake, all of us, for making this work well and help a lot of people and making it safe for the donors. So living donation for the time being is really the only possibility we have to narrow the gap between the people who are waiting and the organs needed. I think more people would do it, and you'll be amazed how many people find out just through the grapevine or reading something, how people are willing to step up and become donors. I think we can do a better job as a community to make sure that their journey in the donation process is easy, is safe, and of course they also have the possibility of not losing too much in the process of donation. The simple example that I have about that, if somebody is working in his own business and wants to donate, there is no safeguard that allows him to stop working for 3 or 4 weeks, be a donor, and come back. So there are many donors that are willing to do it, or many people that are willing to become donors, but just they can't because we are not prepared and we don't have a system in place to really support them in the period in which they're going to be out of work. I mean, many of us are working toward changing a little bit the mentality